I am back. Sorry for the transmission that was bad before. Tell me if you can hear me. I'm looking at the signal as well. Tell me, can you hear me? It is better. Hopefully it would stay better now. So let's start. So once again, one important thing that I wanted to discuss today is about the CDC. CDC has changed their stance to say that the spread of the virus is now more importantly from person to person as compared to from surfaces to person. Remember, we were washing our hands and we were not touching the surfaces. So they are saying that the surfaces may not be that important of the spreaders. That doesn't mean that you start touching surfaces and to become careless. Stay careful. But here is what CDC is saying. Now they're saying that respiratory droplets produced when an infected person coughs, sneezes, or talks, that is a primary way. The second important thing that they are figuring out is that the asymptomatic patients can be spreaders. And I have been saying this like for 2 months now, that asymptomatic people can be spreaders. So they have just updated it here. On the other hand, the virus does not spread easily in other ways. That is a new change, was not there before. That the virus can spread easily, does not spread easily in other way. So what are the other ways? Touching surfaces or objects. From animal to people, from people to animals. So this has been really different now. And I would actually, this is fine. If they came back and they said we are learning more and so we don't believe that surfaces, touching surfaces may not be the primary way of transmission. So that's fine. But they are still making a mistake here. They're saying only droplets. Look, here is a study, droplets and aerosols in the transmission. Aerosols, I did not say anything else. It is aerosols. Aerosols in the transmission of SARS-CoV-2. I have been saying it for 2 months. And why did I say it? Do I just know these things? No, I went and read the literature. Can somebody tell CDC to read as well? So here, a recent study, the result of which were also published in the journal, showed that experimentally produced aerosol containing SARS-CoV-2 virion remained infectious in tissues culture assay with only a slight reduction in infection. Only a slight reduction in infection. So this is an important concept here, and the concept is this. The concept is that we can have larger particles. We can have larger particles which are droplets. And I have done a discussion about it, even the size of the droplets. And then smaller particles which are aerosol. Aerosol can stay suspended in the environment for hours. That is one. Secondly, when we breathe, so let's say this is us. When we breathe, the aerosol, the smaller particle, can go deeper into our breathing system or the airways and cause infection down deeper into the lungs and the airways. While the bigger particles get caught up in the upper airways, so they cause infections here. But both of them can cause infections. And so CDC is still not willing to put aerosol here. They keep saying droplet produced. While there is this study here, and there are many studies here that show that aerosol is also important. What I mean to say by that is that if somebody who is infected, let's say you are going to a doctor's clinic and there are patients who are infected there and they have been there and they are gone, it is possible for half an hour, 1 hour, 2 hours, there may be those aerosol particles still hanging around that can make you sick. So wearing masks is very important. Good. So that is one. Now let's go to the next one, which is also an important news here. And this is also in the New England Journal of Medicine. This is a letter to the editor, May 19. So it is fresh. So May, just now, right? So what they're saying is that they saw during the lockdown, the number of patients with myocardial infarction, heart attacks, reduced by 50%, 48%. That's a very interesting observation. That number of patients with heart attacks during the lockdown reduced by 50%, 48%. So if you see here, the weekly rates for hospitalization for acute myocardial infarction decreased by 48% during the COVID-19 period. And here they have this chart, which is very interesting to see. So here, these red lines are the myocardial infarction or heart attack rates on weekly basis. And this blue line is the COVID-19 patients. So as you can see that as the COVID-19 started rising and as the lockdown started, the red line, the heart attacks went down, which again, the letter does not go into trying to figure out why this happened. Is it that people were sitting at home due to that? Or is it that there was something in the environment outside where when people were, thank you very much, Dr. Zafran. Is it that people, when they go outside, there are factors outside, maybe social factors, maybe environmental factors, maybe others that cause stresses and heart attacks? But I thought this is an interesting study to keep in mind as well, that heart attacks were reduced. With this now, let's go to our last topic for today. And that topic is going to be, remember I discussed yesterday that we are going to start a set of sessions to discuss how can we handle COVID-19. And in this session, or in this set, we will discuss not only allopathic medicines, but we would also discuss vitamins and trace elements and nutraceuticals and probiotics, etc. So for example, we have already discussed vitamin C and D. I would like to discuss vitamin A, and should that be taken or not? Vitamin K, should we take that or not? Vitamin E, which actually seems very good. It is an antioxidant, but it is actually very damaging for pneumonia patient. So we'll talk about that. So that is a series. C and D done, we'll do the rest. Then trace elements, for example, copper, selenium, zinc. And then we have already talked about zinc many times. I think we should talk about copper and selenium as well. So that would be another couple of topics that we would cover. Similarly, nutraceuticals. Nutraceuticals are the things that are herbs or designer foods or other type of supplements and products that claim to be of use in chronic diseases. And I'm going to pick up some of them. I'm not trying to start a supplement education session here, but I'm going to pick up some of those that may be interesting for viral infections and for COVID-19. Similarly, probiotics. Probiotics are actually live pathogens that may be beneficial for us. And they may be beneficial for GIT and for other areas of our system, including viral infections. So we're going to talk about the probiotics. Then allopathic medicine. So we have already been talking about it. For example, hydroxychloroquine and remdesivir and ivermectin and so on. So we'll continue our discussions there as well. My hope with this is that at the end of these sessions, we should be able to create a supplement. For example, today we say that we should take vitamin C, we should take vitamin D, we should take zinc, we should take quercetin. Many people ask me afterwards that, hey, what did you say over there? So quercetin they are present as a supplement, plus this product is present in every red skin vegetable or fruit as well. For example, red apples. So quercetin, NAC, N-acetylcysteine. So these are the things that we have seen so far that can be useful. So I'm going to talk about more things that can be useful. Yeah, for example, CoQ10. So I want to create a discussion here where we, as I assume you are all now with us trying to figure out how to handle this virus, doctors or not doctors. So we try to figure out how do we boost our immune system. I don't want to use the word boost, it should be optimized. Boosted immune system can hurt us. Optimized immune system, how do we balance our health and how do we stay so strong that we don't have to end up in hospitals with this one. So that is the session. In that session now, the way we will discuss, so please keep in mind all the future sessions in this set will be about how do we have what are the therapies that are available, or where does a specific product or drug work. These drugs can be for COVID-19 or for viruses. These drugs can all be put in the antiviral bucket. And then within the antiviral, we would have three main mechanisms that we would discuss. Number one here is the drugs that would block the virus from entering the cell. We have is one such drugs too. So we'll talk about inhibit or stall or slow down or damage the RNA synthesis of the virus. When the SARS-CoV-2 is inside our cell and is replicating, it is making its RNA from which it is going to make its proteins, we'll see the drugs that can prevent that. Then the third set of the drugs we'll see will be the viral replication. We had this guy over here. Replicate virus proteins and replicate the virus. So we look at the drugs that would reduce the replication of the virus. And we have seen some of them, for example, ivermectin and remdesivir. We'll see more of them. So these classes. Good. Now let's continue and talk about. So are you still having the issues with the internet? So I hope that, can you hear me now? Okay, so let's now talk about one last topic for today in this series. So the topic that we are going to talk about is going to be applicable here. So we're going to talk about a drug that works here. This is the viral entry area. So today we'll discuss a drug that can help block the entry of SARS-CoV-2 into our cell. If it would, let's look at that drug. I want to show you some of the studies first. So if you see here are the couple of studies. The first thing for us to understand is that for the virus to enter our cells, remember we have been talking about ACE2 forever, correct? Now with ACE2, I want to add one more drug that we should talk, or not drug, one more enzyme that we should talk about. I keep seeing that there is my audio problem. If this becomes bad, I'm going to change my computer and tomorrow redo this lecture. See what happens. Let's talk about it. Focus here, please. This is the area we're going to talk about. And this is the 2. This is ACE2 receptor or enzyme, correct? We know the virus, the coronavirus has S proteins on it, correct? The spikes on it, right? We know that corona has spikes on it. And we also know that these spikes are that bind here to allow the corona to our cells. Correct? We know this much. Today, so thank you very much. There is a question that about leronlimab. I'm going to do a complete topic about that tomorrow. So please wait for that. So ACE2 enzyme, we know, allows the spike protein here to bind, and then the whole thing is internalized. We have been talking about it from ever, correct? So now let's see what is the important thing. Protein. This protein is TM here. So this protein is TMPRSS2. TMPRSS2. So what does it mean? It means it is the type 2 surface protein, which is a serine protease, and that is present on the cell surfaces. So we have a protein. This protein is necessary to what we say is a priming of the spike of the virus. So the virus, when it comes in, this protein helps the virus bind with the ACE2 and then fuse with the cell. This protein helps it. How does it help that? So now let's make our viral spike here. So let's say this is the virus spike. Virus spike in turn has two parts. We call it S1 subunit and S2 subunit. These two subunits have to be separated, have to be cut for the S1 to fuse here and S2 to fuse in the membrane. So does that make sense? So there has to be two things that need to be done. That the one is called S1 and the other one is called S2. The TMPR, PRSS2. I'm a little confused because people keep saying that they cannot hear me, and so I'm distracted. Yeah, so Nicholas, I'm going to talk about the Compstat Mesylate. So let's look at it. So here is a TMPRSS2. This protein helps cut the spike protein into two units. The benefit of that is the following. When the spike protein is cut into two units, S1 unit binds with the ACE2. S2 unit becomes a coil. There are six helical structures. So simply you can think of that as a spring. So there are 6 proteins that act as a spring, and that spring connects the S protein. So the virus is on this side. S protein is now S2 and S1. One side of the S protein becomes springy and it attaches to our cell's membrane. It fuses there. After it fuses there, the S1 fuses with the ACE2 here, over here. Now when they both are attached, this protein will pull the virus inward. So it kind of like a spring, it contracts. And when it contracts, that is when the virus membrane, this is the virus, the SARS-CoV-2, the virus membrane will come in and fuse here. So the important thing now is if the virus's fused membrane, and this was the ACE2 on which the S1 part of the protein, viral protein spike was connected. This is the S2 part now. With this, then fusion is important for the virus to bring the RNA our cell. two pieces, one brain and the other piece that attaches to ACE2. They together allow the virus to fuse with our cell and bring the RNA inside our cell. Sorry guys, this audio, I think I'll have to redo this one tomorrow after seeing what's going on with the network. So, but let's continue as much of the discussion today as we can. And then I would redo it. So I'm gonna I would redo this talk tomorrow as well. So our network used to be good. I think for a few days our network is congested, and that may be because so many people are using networks. Okay, now that the TMPR SS2, this protein acts as a protease. It breaks proteins, the spike the coronavirus into two pieces, cuts them into two pieces. That is called priming. When the spike is primed, then that spike, one piece of the spike connects with the ACE2, the other piece of the spike connects with the cell membrane of our host cell. That second piece contracts, pulls the virus near the cell membrane, helps it fuse, allows the RNA to go in. So now tell me, this TMPR SS2 is not a virus be able to get into our cell? No, it will not. Right? So now the question is there any drug that can block this TMPR SS2? Is there any drug block this, a blocker for the virus entry? It should be a virus fusion. Blood does that as well. So what is that drug? That drug is been used in Japan since